So, President Kim, before we finish up, maybe just one last locally relevant question. There's a lot of discussion at the moment here in Australia about the potential value of a medical research future fund. Could you share your thoughts on that?
Well, I understand that there are some complicated politics here in Australia, which I won't comment on. But I'll say, if you look at the history of investment in medical research in the United States, it didn't really happen to a great extent until about 1950. Right? It's not. Many people think, there's focus on basic science goes all the way back to the early 1900s. It's just not true. Right? Most of medical education was not based on basic science. And then in the 1950s and 60s, basic science started to grow. But it was really President Clinton in the early 90s that made the huge investments in NIH. And so if you look at the investments that were made in the National Institutes of Health in the United States, and then look at what it led to in terms of the creation of jobs, economic growth, opportunity for scientists to then move their findings into industry and then really literally grow the economy, it was one of the best investments that we've ever made. So in a completely generic way, completely separate from whatever the local politics are, I think that Australia is a country that if it did invest more in medical research could have a huge impact in the world, and that investment could turn around and especially in the medium to long term have a very positive impact on economic growth in Australia. So that's been the experience in the United States, and so I think it's I don't think I'd say the same thing for the Central African Republic, right? It's probably not the top priority for them, but for Australia, I think that there are great institutions of higher education here. In my previous life, we had a very strong relationship with Bond University, and there are great universities here. There are great researchers. I think that it's quite reasonable to think about investment in medical research as part of your investment in the future economic growth of the nation.
Thank you very much. Before we close, can I ask all of you to please stay back here for a few minutes? President Kim is going to step out and just do a quick 3 to 4 minute interview and then needs to leave immediately. So if I could just ask you to wait here in the room while that happens. But President Kim, it's been a fantastic discussion. We've greatly appreciate your insights and you coming here to spend a bit of time sharing them with us. So thank you very much.
Thank you. Thanks very much, everybody.